Good afternoon, everyone, and welcome to Talk Tools and Advice for Working Caregivers. This month's topic is life care managers and geriatric care management. And we have with us today Dan Goldberg of ICOR, who is one of our preferred providers. And he is going to explain to you a little bit more about what geriatric care managers or life care managers do, how they can support working elder caregivers, which is, of course, who we focus on helping as well. And I'm going to turn it over to him.
Good afternoon, everybody. This is Dan Goldberg at ICOR. I wanted to introduce myself and my company and educate you on why we think it's very important for you to consider working with a care manager. We call ourselves life care managers because we holistically look at your entire life. We work with both the elderly population and the special needs population. So we like to see our clientele is typically from age 20 to 120. Now, obviously, you see the management pictures there because at the end of the day, we are managers. We're managing your life. This is a serious question. When a loved one has special needs or serious healthcare related issues, would you have the time, knowledge, experience, training, contacts, and the emotional bandwidth to achieve the best financial and medical outcome for that person? So as care managers, we can help solve those problems while saving you time, money, and reducing your stress. And we thought the picture of the boat tossing around in the seas is exactly what we all feel like when we're under stress and we have to deal with a lot of different things at once, especially things we aren't that familiar with. So the big picture, you can think of us as general managers, contractors, or quarterbacks. I picked Aaron Rodgers of the Green Bay Packers because I've been a Green Bay Packer fan ever since I was a little boy. But the theme here is that the care manager coordinates all aspects of the person's life and helps them achieve their best outcome, both safety and financial and medical outcome. That's our company. We call ourselves life care managers. We're slightly different from care managers in that we holistically look at every part of your life. It starts with a needs assessment. You look at the little circle there. That's our approach. Then we do what we call a life map, which is focusing on both short and long-term goals. Then we coordinate all the services, and then we provide all the on-site quality assurance, and it keeps going around because we keep redoing it and relooking at it. Obviously, you can see the different headings. There's life care management, where we help you maintain your independence, access to proper home care, government programs, community programs. Very important, assisting finding safe and secure living arrangements. Medical advocacy, which is probably what we all think of, care management and coordination, medication analysis, doctor's appointments. We'll talk about that more later. Treatment compliance, another huge issue, and obviously crisis management when stuff happens unexpectedly and it's an emergency. Environmental evaluations are extremely important. Most people want to age in place if they can, but as you get older, the home becomes a little bit more dangerous. My example is my parents live in a 4-story townhouse. My parents are in their late 80s. There are a tremendous number of stairs, which nobody ever considered when they moved in 30 years ago. It is extremely dangerous. And one of the biggest issues we have with the elderly is the danger of a fall. Because once an older person falls, bad things really, really start to happen. If you look at the probabilities of surviving the fall go down the older you get, very, very negative. So that's a huge thing we focus on, is fall prevention. Balance and strength are extremely important. And lastly, we have financial advocacy. One of the things we don't really think about as we get older is our financial acumen. Because what happens is everybody focuses on the cognitive issues and the healthcare issues. the physical issues. We don't really think about the mental issues. And what happens is sometimes, bills go without being paid, expenses kind of escalate. People aren't able to pay as much attention. They can't stay on top of things as much as they can. So we provide that extra layer in being both medical advocates and financial advocates. Now, here's the big picture. Again, what we do as life care managers is we connect all parts of your fragmented life. And I'm going to go around clockwise and talk about this. In the beginning, you have a typical older person that sees a tremendous number of doctors, takes a tremendous number of medications. So one of the first things we do, we send one of our RN advocates in to interview and do an assessment. And what happens is we look at the doctors, we look at the medical notes, we look at the medications. Care coordination is an extremely crucial thing that must be provided. And I'll give you a quick example. And this happens in a hospital, which is hard to believe that it happens in a hospital, but we had a client who was a chronic diabetic in her 50s, and she had comorbidities. She had diabetes, as I said. She had multiple stents. She had a liver transplant, and she also was an opioid addict. So my nurse had to come in and basically coordinate, because even in the hospital, the different doctors are not speaking to one another. So we had to speak to the cardiologist, the endocrinologist, the palliative care expert, to coordinate everything and make sure all the medicines there were no adverse reactions between the medicines, and make sure everybody was on the same page. Medication management obviously goes along with that. Typically, an elder person is taking a lot of medication, and a lot of times they mismanage that. So non-compliance is a big, big issue for the whole healthcare establishment. And the studies show that that is a big, big leading indicator of emergency room visits and things like that, and obviously cost the healthcare establishment a lot of money. Then we go to boots on the ground. So in a typical case these days, all our family is scattered all over the country, all over the world. We as care managers are your boots on the ground. We can be there with your loved one whenever the emergency happens, with the assessment, knowing everything that's going on, and keeping everybody in the family on the same page and well informed. It also happens with what we call elder orphans, which are elderly people that have nobody. We essentially become their family. Between the nurse advocate, myself, and our personal needs coordinator, we're taking care of every aspect that that person needs, because that person generally can't depend on anybody because there's no family left. As I mentioned before, we go to review bills and expenses. Your financial acumen oftentimes goes down as you get older, as you get much, much older, and that is something that needs to be reviewed. And as financial advocates, we also like to assist with that. From there, we go to environmental assessments. And as I mentioned before, most people want to age at home. But the home is a very different place as you get much, much older, and becomes much, much more dangerous. Between, let's say, you may need grab bars in your halls, grab bars in your bathrooms. You may need hallways to be expanded to accommodate a wheelchair. Many things. There might be throw rugs that are very dangerous, chairs on casters. What we like to say is you have to senior-proof a resident. A lot of us have had babies. We've gone through baby proofing, but now you have to consider senior proofing. Extremely important, because as I said before, falling is one of the #1 reasons of bad outcomes. And once you fall, break a hip, bad things happen. Another thing that's sometimes missed, and I like to talk about this, is the socialization aspect. They've done various studies over the years, and it has shown that for mental acuity, for mental health, and also physical health, it is very important to do things like socialization and activities that are not as good for socialization. Obviously, TV watching is the lowest form of socialization and probably what many of us do to a large extent, not good for you. Above that is reading and crossword puzzles and things like that. Those are much better for your mental health. But the best thing for all of us, virtually all of us, is socialization, being out with people, being out with programs, speaking to people, just seeing people is much, much better for your health. I've mentioned, lastly, the personal needs coordinator. The personal needs coordinator is typically a non-medical person that works for us who coordinates many of your resources, from the financial resources to dealing with your insurance companies, to dealing with your bills, to getting you durable medical equipment, DMEs as we call them, if you need a wheelchair, a hospital bed, or what have you. Extremely important. So we connect all those dots and look at your life in a holistic manner to make sure that you are as safe as possible and have the best quality of life given your financial and medical circumstances. So this drills down a little bit more as to what we can do. The first thing many people think of is home care. So that's the first bullet point. The thing about home care is there are a lot of home care agencies, and there are a lot of aides out there. We have a tremendous, all life care managers and care managers have access to a lot of home care and also private aides, depending on the situation, whether you need 24/7. Live-in is much more difficult to get. We help coordinate that and help you find the right people and the right agencies. One thing that's misunderstood or not given enough credence to is caregiver burnout. And we see that all the time. Oftentimes, and again, we have a client where the wife has had Parkinson's for many, many, many years. Her husband is a doctor, and he works himself to the bone taking care of her, even with the aides. And we're trying to get him help, because caregiver burnout is a huge issue, and even sometimes we see the caregivers getting sicker than the people they care for. Finding safe alternatives to living at home, very, very important. Obviously, there are other people in the provider network here, the assisted living companies, the CCRCs, the nursing homes. We do a lot of assessments to figure out what is the best place for you. And oftentimes, a family will say, okay, mom or dad needs a nursing home, but that may not be the best place for them. There are other alternatives in between living at home and a nursing home, and we go over that oftentimes. Boots on the ground, we've talked about. I don't have to tell you how increasingly complex the healthcare system is. It is a maze, it is insane, and it only gets worse every year. Safe transitions to and from hospitals and short-term rehabs, that's a big issue. There has to be a plan in place. Just having home care is not enough. You need a care plan. You need a short-term and long-term plan. There has to be a safe discharge. And hospitals and rehabs, so you know, they're understaffed. They just want to get you out, unfortunately, generally, as quickly as possible and safely as possible. But what happens is you need to have the right things in place. So it always helps to work with a care manager to get that done. We also do, my company does PRIs, which are patient review instruments. Many care managers do that to get you into long-term care facilities that we call nursing homes. In New York State, if you're not in a hospital or you're living at home or you're living in a rehab, that's okay. They will do the PRI, but if you're living at home, you have to have somebody do the PRI and then basically apply to the nursing homes. We've talked about short and long-term plans. Obviously, we help you with, all people help you with insurance and government benefits, all care managers. We all know Medicare and Medicaid extremely well. And one of the most important things we do, I like to say we're kind of like Switzerland, an independent third party, because people are referring clients into us, but we're referring out all the time to people like Genser and people like other accountants and financial advisors, because they are a crucial part of your team to figure out what's the best way to handle the financial and legal aspects of this person's life. And let's plan ahead of time and do it before we're under the gun, because when you're under the gun and it's crisis time, you often have limited alternatives, and they often will cost you more money. And yes, we're an independent third party. So at the end of the day, what I want you to come away from this presentation with, I want you to understand what care managers do, how they help you, and why we really are a vital resource to help you get better outcomes for your loved ones and save you time, money, and help provide peace of mind. Again, this is Dan Goldberg at ICOR. Thank you very much for your time, and I wish you all the best.
And you heard from Dan some overlap about how elder care is the new child care by the senior proofing the home, which was a new term to us. Over 65 million Americans, 29% of all US households provide care for an adult family member. And most of these caregivers, as you know, are working full-time and trying to keep their own lives in balance. And these numbers are only going to grow going forward. So arm your workforce with the information they need now to avoid a crisis later, and bring us in with our talk program. Thank you very much for joining us.